Hi, we are presenting a short PowerPoint on trauma-informed care so that everyone will be ready for an agency self-assessment survey that is being required by one of our funders. Whether you are a janitor, whether you are a director, the CEO, or work in a kitchen, if you are an employee of Banyan, you will be expected to fill out the upcoming survey, and this PowerPoint is going to help you be able to do it correctly. So essentially everybody has to fill out this survey in the coming week, no matter who you are once you receive it. HR is going to be following up to make sure every person has filled out the survey. So be patient, watch this video. And this is really important to Banyan because a lot of people put a lot of effort into this project, and we want to get credit for the work that we did, and we want the funders to know that we did what we were supposed to. So thank you. To better understand trauma-informed care, the first thing we need to know is, what is trauma? Trauma is an emotional response to a terrible event like an accident, sexual assault, death, or natural disaster. Emotional and psychological trauma is the result of an extraordinarily stressful event that shatters your sense of security, making one feel helpless and vulnerable. Trauma is one's perception, and one's perception is reality. One may no longer feel safe. One can experience frightening memories, an array of emotions that can have negative lifelong effects on one's emotional, behavioral, psychological, and physical self. So here's what everyone really needs to know about trauma. It's all about the 3 E's: events, experience, and effects. The events that cause trauma can be as big as being the lone survivor in a mass shooting, or as small as being picked on by a teacher in the 3rd grade. It is the experience, the individual's perception of that experience, that really has the long-lasting effect of impacting somebody emotionally, psychologically, physically, for their entire lives. And it's our understanding of that trauma that makes us better able to meet the needs of our patients, our clients, our consumers. And it also, if you apply it to our own lives, can make us work out better with one another. What is trauma-informed care? Trauma-informed care understands how traumatic experiences negatively affect behavioral and physical health in multiple ways, and is committed to responding to those needs through universal trauma screening, staff education, and training regarding trauma and its effects, and being willing to review and change policies and procedures to prevent the re-traumatization of clients. Trauma-informed care means that we have a paradigm where we consider certain domains, 5 primary domains. Everything we do should consider the safety, physical and emotional safety of our patients as well as our staff. It means we should have a level of trustworthiness. People who have been through a lot of trauma tend to not trust people, so we need to be very careful in being trustworthy and also being as transparent as is possible with our positions. Clients should be given choices when possible. There should be collaboration, not just between the clinician and the patient, but also on a whole team. If we work better together, not only are we happier employees, but we also have happier patients. And then finally, empowerment. People should feel empowered. We don't look at everything that's wrong with them, but we try to build from a strengths model, if you remember that from years ago. So this is the concept of trauma-informed care. You may not remember it, but every new employee receives training about trauma-informed care during orientation. Every employee is also required to complete an online training within 6 months of hire, and then every 18 months. And finally, there's a special committee that's working on how trauma-informed care should be incorporated into our organization. But that's not all we've done. Trauma-informed care is now part of our master plan and clinical supervision. Starting back in September 2014, we started training clinicians in a course called PTSD 202, Skills Training in Effective and Interpersonal Regulation. This is really good for patients or individuals that are suffering from PTSD. In 2015, we modified our job descriptions to incorporate trauma-informed care. In 2014, we distributed, and I can get copies to everybody, of a SAMHSA tip on trauma-informed care for clinicians. And we also have a pending poster project. Okay, so here's your heads up. Next week, you are going to be receiving from myself, Kimberly Bliss, or from Nancy Rudez, an information sheet that's going to outline some of the answers you're going to need to fill out a SurveyMonkey survey. And we did not create these questions. These were given by a funder, and we're having to answer them. And going through the questions, we realized that if you did not have kind of an answer sheet, it will be impossible to complete the survey. And I'll give you a great example. One of the questions you're going to be asked is, what percentage of patients feel safe in their program? Well, clearly we can't read their minds, so a survey had to be conducted. We are currently conducting that survey, and those results we're going to give you so that you can answer that question, and we hope it's a high number. But that gives you an idea of what's going to be coming up next week. So stay tuned. If you have questions, if you are interested in trauma-informed care, you can call Nancy, myself, and we'd be happy to talk to you. Thank you.